Well, the very first thing that the health reform law does for small business is it provides an opportunity for a tax credit. And this tax credit is focused on the smallest companies, the companies with under 10 employees, because 80% of the companies in our country, 4.8 million companies, have less than 10 employees. You get the maximum credit with 10 employees, but you can get a credit, again, phasing out up to 25 employees. So the tax credit of 35% of the cost that you pay for health care is available to small businesses, but only half of small business owners have learned that the tax credit is there, let alone whether they're eligible for it. What a small business has to do to qualify for the credit is, number one, provide health insurance for its employees and pay at least 50% of the premium. The second feature of the tax credit is that it's aimed at lower wage employees because it was felt by Congress that that's where companies are struggling the most. It's not law firms and hedge funds that are struggling to pay their health insurance, but a lot of our mom and pop retail stores. One of the things that small business owners aren't aware of is that the tax credit was actually retroactive to January 1st, 2010. So right now, if a company wasn't aware of it, you can still go back and claim it for all of 2010 and going forward to 2014. Now, in 2014, the tax credit actually increases. When the exchanges go online, where small businesses will be able to go purchase their insurance, they'll be able to go to the exchange and get a 50% credit versus the 35% now for this first 4 years. Also, other employers, nonprofit employers, there's 11 million people in our country working for nonprofits. Again, most of them are small nonprofits, and they're eligible for a credit too. Their credit is smaller because they don't pay tax. They get a 25% credit now, and in 2014 they get a 35% credit. So this is the benefit to all small employers, whether they're for-profit or nonprofit. And one of the important things that we learn in talking with small business owners, and I know this from my own experience of owning a business for 30 years, is that why do you do it? Well, it's a competitive thing. You need to recruit good employees, the kind you need to make your business successful, and you need to keep them. And if you don't offer health benefits, and the big businesses are offering health benefits, and government agencies are offering benefits, or the military, you're at a disadvantage. How are you going to get the people you need, and how are you going to keep them?